When it comes to women's health, ProAxis Therapy can be a valuable resource to physicians.
There are many programs across the nation that don't have pelvic floor therapy. And when ProAxis came to us and said, "Do you need this level of service?" we said, absolutely.
It's an internal physical therapy, and it works. With all the other physical therapies, I've gotten relief, and this is the first time I've had relief with the sacrum all the way down to my foot. I mean, it really is nice. Nice to feel nice.
With a combination of physical therapy exercises and patient education, the Women's Health Program is designed to prevent a variety of health issues.
I think most of my patients, when I talk to them about this resource, don't understand it. To say that I'm going to send you to a physical therapist for a problem with your vagina, that seems a little bit unusual. But when you think about gross anatomy of the pelvis, it involves muscles and nerves and blood vessels. All those things work together just like your arm or your leg. And so with that, I have to tell the patient exactly what to expect. I think it's a very new concept. People are very uneasy because they don't know what to expect. So when you talk to them about what it is, I think they become a little bit more easy with the concept, and then once they go to their first treatment, that experience is suddenly changed. I think they begin to understand why we use those physical therapists. Why do you need it? What can it do for you? I think the first hands-on session that you get really makes a difference.
Well, pelvic floor therapy just deals with any disorders of the pelvis, and it can be anything from people that are prenatal, that are having babies that have low back pain or leg pain or hip pain while they're pregnant. We also follow them postpartum if they have any issues that way. But then we also treat any types of pelvic pain and urinary incontinence, fecal incontinence, constipation, just basically anything that deals with the pelvis in women.
I've had issues ever since I can remember, ever since I started my period with pelvic pain, and it started, early on. I thought I was the only woman that was dealing with this. I honestly thought nobody else is dealing with what I'm dealing with. Maybe it's in my head. You don't know because it's not talked about.
And I think the biggest thing that we can do is make them aware of their body, make them aware of their pelvic floor, their area of the body that's either causing their pain or causing their dysfunction or causing them, to be isolated from the world.
Physicians who have referred patients to ProAxis Therapy's Women's Health Program can attest to the benefits their patients have received.
We work in conjunction with those physical therapists. Those are an integral part of our team.
A whole new dimension to how our patients are treated.
Knowing that I can be more active, I love to walk, and not feel like I have to schedule those walks so that I can get back home to the bathroom.
The outcomes are amazing, and in the 11 years that I've been working in women's health, it's amazing to me to see in just a short period of time how much relief patients are able to have.
I honestly can say that I don't think that we've had one person that has walked out and not said that they've at least learned something and benefited from the therapy in some way.
It has been wonderful. She has taught me things about my body that I didn't know before, and now I realize that I do have some control over it. For the first time, I feel like I can be proactive instead of reactive.
Help your patients learn how to take an active role in their pelvic health. My physician referred me to ProAxis Therapy, and it changed my life.